We're really delighted to be hosting this event with the One campaign. I wanted to just start with a very brief reflection, because last week I was in Liberia and I had an opportunity to visit some of our ODI fellows who are working in the Ministry of Health and the Revenue Authority in Liberia, as well as some colleagues from our Budget Strengthening Initiative who are working in the Ministry of Finance. And actually during the visit, it was a very short visit, and I did a classic development tourism thing when I was there, which is that I took a morning and went to West Point, which is the big slum on the outskirts of Monrovia that goes down to the Atlantic Ocean. And there are about 80,000 people who live in West Point and about 70,000 who live in an adjacent slum. And I was visiting a health clinic in Monrovia, which is in fact in West Point, which is in fact the only health clinic in West Point for 80,000 people. And when I went there, which was part of the official opening time, there was one administrator, no nurses, and there were no medicines in the clinic. So this is for 80,000 people in West Point. The closest next public clinic is about 6 kilometers away. And the thing that really struck me was talking to colleagues in the ministries after, is that actually Liberia has a fantastic health strategy, a universal health strategy, and a commitment to providing essential medicines and treatments for all for maternal and child health and other basic health requirements. And the health ministry, and one of the ODI fellows there actually, has done some costing work for what it would actually take to implement this this strategy. And this is very basic stuff. So it's I think it's 3 antenatal care visits, some immediate follow-up treatment and so on, and essential medicines for malaria, diarrhea, pneumonia, etc. And the cost of the strategy would be somewhere around $350 million annually to do it. The current total health budget is 60 million from public health financing. And so that's a slightly circuitous route to a UN summit in Addis. But I think the truth of the matter is that if that summit can't find a way of bridging the gap, that you can set the bar wherever you want for the sustainable development goals, eradicating avoidable child deaths and avoidable maternal deaths by 2030. But unless these summits can actually deliver results in terms of closing the gap, it's not going to happen. And we run the risk, I think, of ending up in a scenario that debases the currency of goal setting and target setting, because ambitious goals that aren't backed by real money actually aren't really worth the paper that they're written on. Of course, there's a lot more to it than money, but I think without the additional finance, the targets are not going to be achieved. So we're at a really critical moment in the planning for Addis. We've had a zero draft and a first draft now, and certainly on some interpretations, the first draft of the summit document is a backward step, not a forward step. It clearly doesn't have the specific and concrete and practical commitments that are needed. I think the next drafting phase is actually next week. I've got colleagues in the room who are following this much more closely than I am. But this is clearly a really critical moment in the planning cycle for Addis, which is why I'm really delighted that we've got Eloise Todd from the One campaign and Romney Greenhill from ODI to talk about the 2 reports. And I think the good news about the reports is that from very different starting points, they've sort of arrived at roughly the same place, which I think certainly indicates we should all be working much more closely together. And I really hope that one of the things that we can do in this meeting, apart from looking at the financing issues, is really thinking about how we all harness our resources more effectively to generate the outcomes that we need to see. We're going to be joined, I think, at around 4 o'clock by Christophe Merdies from DFID, who is one of the people in DFID who's leading the planning for this. But so the format is Eloise is going to speak first, and then Romilly for around 10 minutes, 10 minutes each. Apart from being Global Policy Director, you were previously doing the work on extractives and revenue mobilisation in one, so you've got very strong background in this area. And Romilly is a team leader on development finance here at ODI and co-author of the flagship report, which she'll be speaking about shortly. So, Eloise, over to you.
Thank you very much, Kevin, and real pleasure to be here and see so many friends in the audience as well. So, hang on. Oh, great. So, One's data report this year, for those of you that don't know the One campaign, we're a campaigning and advocacy organisation with 6 million members around the world, at least a third of which are in sub-Saharan Africa. And we fight to eliminate extreme poverty and disease. And we have this annual report, the data report, that we've been running since 2006. It originally started as a way to hold the G7 to account on their Gleneagles commitments. And this year, we wanted to still do the aid accountability exercise using the DAC figures from April, but we also wanted to have a very sharp look towards the Addis summit in July. We really consider this to be the pivotal point of the year of 2015. Obviously, the global goals will be launched in September, but as we all know, a lot of that is cooked. The goals are certainly well baked. The targets are, just about ready to come out of the oven, and the indicators are in process. But really, we think that, as Kevin said, without the kind of financial backing in terms of dollars, but also in terms of the rules of the game, the way that we can change the rules to make it fairer and better for the people living in the deepest poverty in the poorest countries, then we won't have achieved our mission this year to leave no one behind. So with that in mind, we really wanted to focus on the Addis summit. So we have 5 asks to leaders, and we really think that leaders should show up in Addis Ababa. Ministers of finance are very, very welcome, as long as they bring their leaders along with them. And we want this access to basic services and minimum spending levels to be a key deliverable from Addis Ababa. As we all know, the halving of extreme poverty in the first set of the MDGs was absolutely great, but that second half is going to be so much harder to reach. It will take more effort, it will take more intentional planning to reach the poorest people in rural areas and beyond. So we really think that having a per capita minimum spend for health, education, social protection is absolutely key. And that could be a really game-changing outcome in Addis. We need to pay for that. We need a combination of domestic resources. So we need to invest in ways that make it easier for developing countries to raise their own revenues. And crucially, we need that 0.7 target. Very gratifying to see that reaffirmed by the EU a couple of weeks ago. And for the first time ever, see it appear in a G7 outcome document. What we were less happy with is everybody recognises the slump in aid to LDCs, least developed countries, but we don't think that the targets are ambitious enough on that. And we're fighting very hard for half of aid to go to LDCs. We think inclusive growth is important, obviously, to keep expanding the pot for those domestic revenues, and we hope to see some deliverables there. And we're also working on the data revolution and trying to land that somewhat and give it some concrete outcomes in Addis, working with governments that can come up and announce investments in national statistical offices, but also perhaps opening up their own data. So we've got less than 5 weeks to go to Addis Ababa. But there's lots of opportunity along the way and still time to really make it a really big success. This week we have the African Union Summit. I would urge you all to read Ellen Johnson-Sirleaf's blog in the Beyond BRICS section of the FT, where she spoke very clearly in favour of both the 50% to LDCs target and also the basic minimum spending, basic social services package. So she's very much on board and said that very loudly at the G7 last weekend, and is hopefully corralling her fellow African leaders as well this week. We've got the final drafting session in New York next week, and informal negotiations going on right now. And on these two issues of the basic social compact and 50% aid to LDCs, they're both pretty much under threat. So all of you that care about these issues, it would be great to do outreach to national governments and really use this last stretch of the negotiations to really get those over the line. We've got the European Council in Brussels at the end of June. Normally they just kind of rubber stamp what was decided at the end of May. We want them to actually be more ambitious and affirm more ambitious targets on aid to LDCs. And then we've got Addis itself with the CSO forum. I'll start to speed up a bit. So I think I've gone through that, the FD negotiations and state of play. We really think there should be strong political leadership. And there are signs that on these two clear asks, as I've said, the Ellen Johnson-Sirleaf clear commitment to those two asks of 50% and basic social services. We've also had public statements in the last couple of months from Ireland and Belgium, small but mighty, committing to spend 50% aid on LDCs. So why this focus on LDCs? Well, this graph, the green lines, the high green line there shows the extent of poverty in 2012, and those people living below the line on your left, that's the $1.25 line. So you can see all the area beneath that green, lots and lots of people living at a very low level. And then the lighter green line shows where that will be by 2030 using a particular modelling projection in our report. The red line and the pink line show the equivalent for 2012 data and the projected pink line for 2030 for non-LDCs. So the people living in LDCs are poorer than those living in developing countries that are not LDCs. So I've talked a little bit already about this basic package to deliver social services. The idea is to really focus on the poorest people in the poorest countries to make sure they have access in principle to health, education, social services. We originally looked at, not only with colleagues from ODI, but also proposals made by Homi Karas and John MacArthur, who came up with this $300 figure, which after various batting around, we wanted to make sure that was a bit more ambitious. So we raised to 500, and you can find the reasons why in the report. And we worked out the funding gap, so how much more money it would take to get to that level for all LDCs. And it's 34.5 billion in dollars for LDCs alone. Once again, just to sort of put the point on why LDCs, on the left you see, what year is it? It's 2003 levels for LDCs on the left, and the bigger bar is non-LDC developing countries. And then fast forward to 10 years to 2013 data, and the LDCs, well, it's doubled, it's more than doubled, possibly even tripled, but look at that shooting upwards of the non-LDC countries, and you'll see the grey shading is the proportion of ODA spent in those countries, so a much bigger reliance upon ODA for the poorest countries. And also showing why that blue, the domestic revenues, need to be increased. That's just, so on to the aid question. Where are we on aid? That's the EU's progress towards 0.7. They would have to get their climbing gear on and scale that yellow line to get to 0.7 collectively. The trajectory has been a little bit disappointing, but we're happy that they reaffirmed that commitment at the end of May. These bubbles, if you've got a copy of the report, this is our favourite graph, I think, the bubbles. You can see that tiny pinprick on the top left, Iceland spending above 50%. That's the 50% line at the top. Across the x-axis, it's the percentage GNI spend. And that huge circle on the right is actually the UK, doing well, going beyond the current UN target, and floating reasonably near to the top. They're at 38% at the moment, so it wouldn't be that much of a stretch to commit to that 50%. And that's 50% depicted by other means. The green is go for Ireland, and then the countries below it showing how far they are in numerical terms from that 50%. And Japan is the G7 country that's closest to that target. And one other thing we're really pushing for is this data revolution. We can't tackle poverty if we can't map poverty. We need to know where it is, and we need to know who is out there living in the poorest circumstances. And the fact that we haven't really known that, and some of our best data dates back over a decade or more, is pretty shocking. And so we're working hard to gather, as I said, governments, businesses, foundations, to try and see what they can do with their own data, but also to make investments in country systems so that they can map their own poverty and therefore spend money more wisely and get those resources straight to the results. So I think I'll leave it there. Look forward to discussing particularly the social compact and 50% more, and thank you for your attention.
Thanks. That was a great, very succinct presentation. Let me just, and I'd really recommend that everybody read the report. Not only does it have brilliant graphics, but it's actually a brilliant narrative and argument as well. Let me just ask you, I know is a mean question. So if you want the UK to go to the 50% bar that you said, where and who do you want the money moved from?
Well, there's 22% of their aid, I believe, that is currently unspecified. So if they could shine a big spotlight on that for a start, they might find that they're actually way beyond 38% anyway. They might even be already there. And actually, one of the most interesting things about this 50% push is that conversation about transparency with donors. The amount of unspecified aid in the US, for example, is nearer to 30%. And the idea that that much money can't be tracked to a country, and obviously there are other ways of breaking down that aid. So we think that there are sensible ways of discovering where the unspecified aid is. And also, we all know there's some aid is better than others, and there are things like the student imputed costs and immigration costs, and admin can always be lowered a bit. So it's not like we have to, rob from Peter to pay Paul. There's a way of increasing the quality of aid, and frankly, the UK has done a brilliant job of getting to 0.7, and we shouldn't underestimate that, and continually we should praise them for that. But now, therefore, it becomes even more important that what they do with their money is of real importance.
Okay, thank you.